gonna do trach dressing change. So first of all, we're gonna do hand hygiene, check the patient's information and doctor's order for the patient, for the humidification and the oxygen level needed for a patient, and the trach size for the patient. And we're gonna, of course, educate the patient that we're gonna do their dressing change today, and we're gonna maintain asepsis throughout this dressing change, and we make sure that the patient is in semi-forward position. And so now I'm gonna check for the Trach Safety Check. I'm gonna check that the suction is on correctly and about 80 to 120 millimeters of mercury, and it's active. And to check that, we're gonna have to make sure that it's on. And to do that, we make sure that it's active using the thumb. And right now it's on, it's about 100. I'm going to change to 110. And we want it around 80 to 120, and we can also check that using here. And now I'm just gonna put that on right there and just turn it off for now. And after that, we're gonna have to make sure that the oxygen equipment is connected correctly as per the doctor's orders. So the doctor's ordered for humidification of 60, and we need about 10 liters of oxygen. So make sure it's on. Now that we know that it's correct, we make sure that we have the safety equipment ready. We have the trach tube, we have the drainage sponge, we have the inner cannula, and we make sure that we need to get a right one. Right now it's not the right size for the patient. We need a 7, so I would ask my nurse to get me like a new one. And we have the dilator right here, and we have the trach ties, and we also have the manometer right here to check the pressure inside the trach, to make sure that it's around 20 millimeters of mercury pressure, so we don't have any aspiration. And we have the ambi bag ready for any emergency, and that we have the correct suction catheter. And to check that, we need to have the size of the trach. So from the order we have the 7, and we're gonna do the calculation of -2 and ×2. So I'm gonna get 10 French catheter. So we have 10 French right here, and we make sure that we have the sterile water and normal saline ready in our bedside. After that, we're gonna pre-oxygenate our patient for about 30 seconds. We have to ask them that they need to take 2 to 3 deep breaths for about 30 seconds. So take 2 to 3 deep breaths, and then we make sure that we put on the O2 sats monitoring. So we make sure that's about 100% before we remove the oxygen equipment from our patient. So after 30 seconds, we can now remove this.
We can also check for the cuff pressure from here and make sure it's within 20 to 30.
And we have the ambi bag ready on our bedside. Just in case the patient would need this. I'm just going to put this on the side. this one right here. Put the oxygen right around there. Open up, just so that the patient is still getting some oxygen. And now we're gonna do suction. I'm gonna get my suction catheter ready.
I can use my so for this one, I'm going to put in the
So now I'm just gonna wear gloves.
Moving on to Trach.
Do hand hygiene. And make sure it's fine. And that we have an active suction of around 100. So that's within 80 to 120. So we're good. And we need 5 inches sterile, because that's the one that's gonna go into our patient for suction. Oh, before you suction, make sure that we tell the patient that we're just gonna suction just to warn them. And we're gonna do this, rotating this.
And after we are done with that, just going to knock and take off the
Rotating it.
we're going to make sure that we keep it as close as we can, just in case patient needs oxygen while
We have to do this for about 10 to 15 seconds. Then we're gonna withdraw. Then we can now throw this in the garbage. And I'm just gonna throw this in the garbage. And to make the tube patent, we make sure that we saturate this on sterile water. And we're gonna get clean gloves, and for the sake of the video, I'm just gonna use this one that's available. And just take this out. And now after that, I'm just gonna put new gloves. Do hand hygiene. And we keep checking the O2 sat of the patient, making sure it's not dipping down. And if required, we're gonna make sure that we put the oxygen equipment once again if the oxygen sats dips down to below 88%. And now we're still around 98%, so we're good. And after that,
extra small, top and bottom. Okay, so
we're gonna do the dressing change using a sterile technique. I'm just gonna use no touch. And so first I'm gonna stabilize the tray. And I'm just gonna remove the old inner cannula. Okay, and then I'm just gonna throw this in the garbage. And for for the sake of the video, don't have enough gloves with me right now, so I'm in a real setting. We're gonna do hand hygiene and use clean pair of gloves. So after hand hygiene, we put on the clean pair of gloves, and then we're gonna remove the old dressing carefully. We don't want to cause any injury to the skin of the patient.
I did bump her.
And then after that, we're gonna do change of gloves again using
I just giggled to myself. I was like, I'm
just so we get a success technique throughout this video. And since I don't have enough gloves, I'm just gonna change one pair. So in a real setting once again, we're gonna do hand hygiene, put on a clean pair of gloves, and then after that, we're gonna assess the stoma sites and the periskin just to check if there's any swelling or any excess drainage in that area. And after that, now I can clean the stoma sites near the periskin. So I'm just gonna use normal saline.
But it wasn't during the video. It was. No, I don't know. Like, she was like done. Like, she was like, that's it. This was not my intention.
And I'm just gonna use a Q-tip, dip in normal saline, and clean the peri-wound skin around the stoma.
Telling her what to do during her thing.
So clean technique right there.
At the end, she was like watching it. Like it was.
One swipe. And we should also do at the top, carefully.
In this one, right?
One swipe.
I keep forgetting to tell you.
Carefully again, one swipe. There, and now we're gonna also use the 2x2s to clean the stoma.
That's so funny. I enjoyed that. I enjoyed it.
Dip in normal saline.
Because I remember making a comment.
And one swipe. And one swipe again.
You are so bad.
And the dressing and the cannula.
And also the top of the stoma.
Yeah, it's
And then I'm just gonna clean just below the chin area, and then near the chin too. And just around this part right here. And then I'm just gonna dry. And you wanna make sure that the patient is semi-dry. So now I'm gonna be doing a quick check. So first, I'm gonna check for the suction, you wanna make sure that you're doing 80 to 100. So you will just cover the end here. So just around right here. gonna put
So now we're going to take the
the drainage sponge.
cannula. So
I think I touched that, so I'm gonna get a new one.
So we have the sterile tray set up over here. We have the few cotton tip applicators over here. We have 2x2 and some 4x4 if needed.
After that,
And we have the beam sponge and my forceps. And we also have
making sure that we're keeping the area where we're gonna insert near the stoma sterile. So just below the peri-wound right there, and just carefully making sure not causing any injury on the skin. We pushed the I'm just gonna use the blunt end to push. Okay, now we're done. We see we don't need this anymore. We can just use our fingers to lift this up. And now that we have that ready, we can now put the oxygen equipment back to our patients, and
we're gonna be monitoring for the OB sense and discharge rate, the oxygen there. And so
we're just looking once again on the auto sets, and we're still good. And now just okay, so I think that's all from mine. And then we also have to, of course, document that we've done the trach dressing on our IPNs and on our cardiacs. And